We'll now move to 5 minutes of questions for committee members, and I'll begin. Dr. Woodcock, you said something very important about the mandates from 2007. We know in this committee that, we are a feast of well-intentioned good ideas here, and they come from all directions, from the right and the left. And we see that in higher education, where a number of us have invited the higher education community to talk to us about simplifying regulations, and they came back with 59 specific recommendations. Our purpose here is to enable you, not to slow you down. We want to align federal policies, and that means our laws and our regulations, with an opportunity for more, not less, safe innovation. So I would invite each of you to form your own internal red team for red tape, and if you see things that are in the law or in regulation, or even that the Office of Management and Budget makes you do, and that you think are non-productive, let us know, because this train is going to get to the station. We're working with the House and with the President, and this is an opportunity to clear the clutter out of the way and to take advantage of a rapidly changing landscape. Now, Dr. Austin, we've heard a lot about the valley of death. I had some Vanderbilt researchers explaining that to me the other day. More money obviously would help, but what you talked about it some, what else can we do to shorten the period from discovery to medicine cabinet and this middle ground where so many, 8 out of 10 medicines fail for business reasons or for medical reasons? Is there anything else we should do?
Thank you for the question. First, it is important to say that as it will not surprise you to learn that there are many, many more of those Valley of Death crossing projects that we have proposed to us than we can possibly fund. Currently, the number is currently 96% that we cannot fund. And it's important to realize that the sea change that's happened since I was in training 30 years ago, there were tens of opportunities to intervene in a rapid way for patients with untreatable diseases. Now that's in the thousands. And so the opportunities have really exploded.
But if 8 out of 10 don't succeed, if that's anywhere close to right, any way you can, other steps you can take to reduce that number with whatever dollars you have?
Yeah. Yes, and I'll give you some examples. One, beyond the direct support, is these projects traditionally have been done in a rather disparate fashion. So this requires a team to do this, requires people of different expertises, often 8 or 10 different expertises in different sectors. So academia, biotech, pharma, VC, patient groups, regulators, and traditionally they've tended to work in silos. And it's one of the reasons why everything NCATS does is done as a collaboration. And what we find is what our mothers told us, that many hands make light work, and if you put together a team...
So collaboration is one answer. Anything else?
I can't let this go by without mentioning the...
If you could do it in 25 seconds,
the administrative,
so I could go to another question.
Yeah, the administrative limitations that Dr. Collins has talked about, the travel, the hiring issues. Those are big issues for us because of the collaboration.
I have encouraged Dr. Collins, literally, I had a good visit with him last week, to form a red team for red tape and give us a list. And we know that some of those things are your fault, some of them are our fault, some of them is the Office of Management and Budget, but we can put the spotlight on all of them, and we'll try to change the ones that we can that get in the way of your good work. Dr. Woodcock and Dr. Shuren, I have just a few seconds left, but we hear that in Europe, it's easier for regulators to take advantage of outside expertise. And as the world changes and so much is going on in the area in which you work, surely you can't have enough smart people inside the system to make all the decisions you need to know. Are there things we can do to make it easier for you appropriately to involve experts from outside your agencies to help you deal with these issues?
Well, we, in trying to address that, we set up what we call a network of experts. We are leveraging the networks already existing in healthcare professional and scientific organizations. I'd say our biggest holdup is some questions rely on confidential information that's in the possession of the company and it's theirs to own. And because we can't share that information, we can't leverage those experts as well as we could. That is a limitation.
Thank you very much. Senator Murray.